Imagine you're sleeping on a cold stone floor on a really thin mattress. You can't sleep on your back because you have a skin rash, and you have searing joint pain every time you try to get up. That's what one Kansas City man endured in ICE detention.
Those are really horrible days for me. I can even walk to the bathroom. Like being on jail with that pain is just like what's gonna happen to me.
I spoke with three recently released ICE detainees and multiple lawyers about what conditions are like at the Chase County Jail in Kansas. It's become one of the primary ICE detention centers in the region. We're keeping the detainees anonymous because they're worried that speaking out could endanger their immigration cases or lead to retaliation. So, this jail is in Cottonwood Falls, Kansas, about a 2 hour drive southwest of Kansas City. For Chase County, their agreement with ICE has been a moneymaker because the federal government pays them more than $100,000 a month to hold detainees, according to our estimates. The jail only has the capacity to hold 148 people at a time, but our partners at KMUW found that this year the jail had exceeded that capacity 18 times in a single month. And overcrowding is just the start of the jail's problems. There's also a pattern of medical neglect. And because the Trump administration has made it nearly impossible for many detainees to get out on bond, people can essentially get stuck in jail indefinitely. The Kansas City man I spoke with, who has since been released, said that jail staff consistently ignored his request to get treated for gout, and he got a rash while at the jail, which he thinks was caused by the soap they provided. Another detainee, a father of three, told his lawyers that he went weeks without care for what ended up being a severe tooth infection. The pain got so bad that he chose to voluntarily return to Honduras, even though his kids still live in the area. I asked Chase County Sheriff Jacob Welsh about some of these accusations made by detainees. Welsh would only say that his facility has received positive feedback from independent inspectors in the past. And just for context, reporting out of other immigration detention facilities across the country has revealed even more shocking allegations. And I'm continuing to report on plans to open another ICE facility in Leavenworth, Kansas, just outside of Kansas City. I reached out to ICE for comment, but all officials would say is that they're bound by national standards for sanitary conditions and medical treatment. ICE also told me that they would be happy to look into accusations by former detainees as long as I give them personally identifying information about my anonymous sources. I did not do that. For the Kansas News Service in KCUR, I'm Zane Irwin.